Your pharmacist knows things about your medication that your doctor never told you, and some of these secrets could save your life or save you thousands of dollars. Let's start with the biggest secret. Generic drugs are identical to brand names, not similar, identical. The FDA requires generics to have the same active ingredient, same strength, same dosage form, and same route of administration as the brand name. They have to prove bioequivalence, meaning the drug enters your bloodstream at the same rate and same amount. That $200 brand name cholesterol medication, the $10 generic is chemically the exact same thing. The only differences are fillers and binders that don't affect how the drug works. Pharmaceutical companies spend millions convincing you that brand names are superior. They're not. Here's something that'll shock you. Your prescription prices are essentially made up. The same medication at the same pharmacy can have wildly different prices depending on how you pay. If you use insurance, you might pay $50 copay. If you pay cash, it might be $12. This happens because of pharmacy benefit managers, PBMs. They're middlemen between insurance companies and pharmacies, and they negotiate prices that often make no sense. Your pharmacist sees this every day. They know your insurance is overcharging you, but they can't always tell you because of gag clauses in their contracts with PBMs. Some states have banned these gag clauses, but many haven't. Pharmacists can see every prescription you fill at every pharmacy. There's a database called the Prescription Drug Monitoring Program in most states. When you doctor shop, trying to get multiple prescriptions for controlled substances, your pharmacist knows. When you're taking medications that dangerously interact, even if prescribed by different doctors who don't communicate, your pharmacist catches it. They're the last line of defense between you and a potentially fatal drug interaction. Pharmacists can refuse to fill your prescription if they believe it's unsafe, inappropriate, or potentially being abused. If you're learning secrets that could save you serious money and protect your health, hit subscribe. We're exposing what the healthcare system doesn't want you to know. Let's talk about something pharmacists see constantly. You're probably taking your medication wrong. That antibiotic that says take with food, that's not a suggestion. Some antibiotics are absorbed better with food. Others need food to prevent stomach damage. That prescription that says take twice daily, that means every 12 hours, not just morning and night whenever you remember. Consistent timing matters because drug levels in your blood need to stay within a therapeutic window, high enough to work, low enough not to poison you. Here's one that surprises everyone. Grapefruit juice can kill you. Not by itself, but in combination with over 85 medications. Grapefruit contains compounds that block an enzyme in your intestines called CYP3A4. This enzyme breaks down many medications. When it's blocked, drug levels in your blood can spike to toxic levels. We're talking about common medications, statins for cholesterol, blood pressure meds, anti-anxiety drugs, immunosuppressants. One glass of grapefruit juice can affect this enzyme for up to 24 hours. The expiration dates on your medication aren't as strict as you think, sort of. Most medications remain effective well past their expiration date if stored properly. The military studied this extensively and found that 90% of medications were still effective 15 years past expiration. But here's the catch: potency decreases over time. That expired pain medication might be 80% effective instead of 100%. For most drugs, that's not a big deal. But for life-saving medications like EpiPens, nitroglycerin, or seizure medications, reduced potency could be fatal. Pharmacists also know which medications are complete wastes of money. Cough syrup? Multiple studies show it's barely more effective than placebo for coughs. That $30 bottle of name-brand cough suppressant works about as well as honey. Multivitamins for most healthy adults? You're creating expensive urine. Your body absorbs what it needs and pees out the rest. Probiotic supplements with billions of cultures? Most die in your stomach acid before reaching your intestines. Here's a secret that'll make you angry. Medication is priced based on what the market will bear, not what it costs to make. Insulin costs about $6 per vial to manufacture. It sells for $300 in the US. The same vial costs $30 in Canada. Why? Because pharmaceutical companies charge what they can get away with. Your pharmacist sees patients ration insulin because they can't afford it. They see people die from rationing life-saving medication. and there's nothing they can do except help you apply for patient assistance programs or manufacturer coupons that most people don't know exist. Pharmacists also see the dark side of polypharmacy. They fill prescriptions for patients taking 23 different medications prescribed by 6 different doctors who don't communicate. Each medication has side effects. When you combine them, those side effects multiply and interact in unpredictable ways. Your pharmacist can see this happening and will often call your doctor to suggest alternatives, but many doctors don't appreciate pharmacists questioning their decisions. Let's talk about something most people don't know: pill splitting. That 20 milligram tablet that costs $60 for 30 pills. The 40 milligram tablet often costs the same $60 for 30 pills. Your doctor can prescribe the 40 milligrams. You split them in half, and you've got 60 doses for the same price. This works for many medications, but not all. Some pills have special coatings that control how they're absorbed. Split those and you've ruined the mechanism. Your pharmacist knows which pills can be safely split and which can't. Here's something pharmacists hate: people not finishing their antibiotics. You feel better after 3 days, so you stop taking them. You've just created antibiotic-resistant bacteria. The weak bacteria died. The strong ones survived and are now multiplying. Next time you get that infection, the antibiotic won't work. This is how we get superbugs like MRSA. Your pharmacist knows that you're not finishing the full course because you don't come back for refills on schedule. Pharmacists can also see your medication adherence, or lack thereof. If you're supposed to refill every 30 days, but you're refilling every 45 days, they know you're not taking it as prescribed. For chronic conditions like diabetes, high blood pressure, or HIV, missing doses has serious long-term consequences. Your pharmacist can see the pattern and knows you're heading for complications. If this is opening your eyes to how the system really works, make sure you're subscribed. We're breaking down the truth behind healthcare that could save you thousands. Here's one that affects almost everyone. The pharmacy isn't trying to scam you with, "We need to order that." Pharmacies don't stock every medication in every strength. Some medications are rarely prescribed, some are expensive to keep in inventory, and some have short shelf lives. But here's what they're not telling you. You can often get it faster at a different pharmacy. Chain pharmacies can transfer inventory between locations. Pharmacists also know things about supplements that could save you from serious harm. St. John's wort, a popular herbal supplement for depression, interacts with dozens of medications: birth control, blood thinners, antidepressants, HIV medications. It can make them ineffective or dangerously potent. But supplements aren't regulated like medications, so the interactions aren't always flagged in the system. Natural doesn't mean safe. Arsenic is natural. Here's a final secret that changes everything. Your pharmacist is probably the most accessible healthcare provider you have. No appointment needed, no copay. You can walk in and ask questions. They've got a doctorate in pharmacy. That's 6 to 8 years of education focused entirely on medications. They know more about drugs than most doctors. But people treat pharmacies like fast food drive-thrus, grab their pills, and leave. The pharmacy isn't just a place to pick up pills. It's where the secrets of the healthcare system are hiding in plain sight. Your pharmacist knows what your medications really cost, which ones actually work, how they interact, and how to use them properly. They see the waste, the overpricing, the dangerous prescribing patterns, and the patient's suffering because of a broken system. Next time you're at the pharmacy, don't just grab and go. Ask questions. Your pharmacist has answers that could change your life. They're just waiting for you to ask.